Thank you so much for having me here. It's such a pleasure to be at this event. I love seeing people coming back after so many years and still loving this school and this place. It's just an honor to be here, and I've had so many interesting conversations already today. So some of you may know that 1 week ago today, the Senate passed a bill that would dismantle the Affordable Care Act, or as it's more generally known as Obamacare. And the law was passed in March 2010. So it's been 5.5 years since that law was passed. And yet here we are still. The Congress is trying to repeal it and vote it down. And so what I wanted to do briefly today was talk a little bit about the law, how it's been implemented, what effects it's had so far, talk a little bit about Republican efforts to dismantle the law, because it really is on the Republican side that most of the efforts are taking place. And then end by talking a little bit about giving you my thoughts about why this is the case. And I don't want to spend all my time talking. I'd love to hear from you and engage you in a conversation about this. So let's roll back to 2010. The Obamacare was passed with one primary goal, and that was to cover the 47 million uninsured in our country, which was about 18% of those under 65 years old. And I should note that we are the only developed nation in the world that does not provide universal coverage, or had not up to that time, to its citizens. Everywhere in Europe, Japan, you name it, they have got universal coverage. We were the only ones left standing who didn't do that. And of course, it took time for the law to roll out, but in January 2014, so we're almost to 2 years, everyone in the US, with some small exceptions, but in general, everybody in the US had to show that they had health insurance. And you probably know, and most of you probably get your insurance through Medicare, or people get it through their jobs. But what this law did is it allowed other mechanisms for people who didn't get it through those kinds of programs. So namely, if you did not get insurance through your employer, you could go to a newly established healthcare exchange where you could buy health insurance and you could compare plans across the same sort of benefits, which made it easier for people to shop for their care. There were subsidies put in place so that if you didn't earn enough, you would have enough money to cover yourself and be able to purchase the care. And you would be able to have Medicaid expansion. So Medicaid is our program for low-income people. It is a state-based program. Many states did not allow even very poor people to qualify for health care. And what the law said is, you up to 138% of poverty, you will be covered by Medicaid. That, just to put that in context, that is for a single person, that's about $16,000 a year. So very poor. If you're a family of four, it's about $33,000. So I think we'll all agree that, most of us could spend that much on a car. The law went in front of the Supreme Court twice. The first time was they upheld the law, but they said states did not have to expand under Medicaid. And then the second time was this past summer, where it was also upheld. So that's what the ACA is all about. So let's talk a little bit about what has happened since it's been implemented. Nearly 17 million people have gotten insurance now through the Affordable Care Act. Nearly all of that decline has been in the adult population. We, as Americans, tend to think that we should cover children even before Obamacare, because it's not their fault if their parents don't have a job and don't get insurance. We will cover kids. So most of the effect of the ACA has been mostly around adults getting insurance. As of November last month of this year, 30 states and the District of Columbia had expanded their Medicaid program to cover the very low-income population. The interesting thing about that is that leaves obviously 20 states who decided not to. And so there is a group of people who then fall out of this. So these people that earn, if you're a single person below $16,000 a year, you don't have, if you are in a state that did not expand Medicaid, you cannot get insurance. You can't go to the exchange. The exchange is only available for people in that next tier up, basically 100% of poverty level up to 400%. So right now, in those 20 states, there are about 3 million people who fall into that bucket there. In the exchanges, about 10 million people have got their health insurance through these exchanges where they bought them. That still leaves us with about 32 million people who are uninsured. So who are those people that are left who haven't yet signed up? It is the law, after all. You're supposed to have insurance. So some of them are those people that didn't qualify for Medicaid and because they didn't expand it in their state, so they're sort of left out of the game. The second group are people who are not citizens of the country, because the law was passed and you had to be a citizen to qualify for any of these programs. And the third are a group of people who say, even with a subsidy, it's still too expensive for me, and so I would rather pay a small fine than have to get insurance. And you pay that fine when you pay your income taxes. So, a lot of people have gotten health insurance in the first 2 years of it being required. So a lot of people said, well, that's all well and good, but if you try to cover everybody, we're going to end up with high costs. Everything's going to be going up. The cost of insurance, we're in a bad situation. There aren't enough controls in the law. And if you look at the numbers, you may know that we spend about 17-18% of the gross domestic product on health care in this country. Over the last 5 years, health spending has actually, in an annual growth rate, only gone up 2 to 3% each year, which if you look historically is at an all-time low. For years, I used to teach my class, and we'd talk about health spending, and it was going up at like 8%, 9%, 10% a year. And, you do the extrapolation out, and pretty soon the entire gross domestic product was going for health care. So it's moderated a little bit. This last year, the newest numbers that just came out in the last month or so predict that in 2014, it's going up about 4 or 5%. But if you look at historically, that actually isn't that different. Would we like it better if it was staying at 2 or 3%? Yes, of course. But it's not that high. The other thing people said about the Affordable Care Act when we passed it is that we will never rise out of the recession. People will, businesses are going to drop employees. We can't afford this as a country. And you know that the economy's been growing now at about 2 to 3% a year. It's not fabulous, but we're in a heck of a lot better place than we were, in the 2008, 9, 10 period. And unemployment is now down to 5%, the latest numbers this past month. So if you paint that picture that I've just given you, there's actually a lot of good that has come out of the original goals. And we can talk about sort of the details, and believe me, I'm the first one to tell you I don't think it's a perfect law. But there's a lot of good, I would argue, that has come out of it. However, if you look at public opinions and polling about the ACA, the amazing part is that since 2010, about 40% of Americans say, great thing. We love the ACA. 40% say, I don't like it. And I have no idea what those 20% are who can't seem to still make up their minds about the thing. But it's basically, it wavers up and down, but it essentially has stayed the same. So what explains all of that, right? Why is it that given sort of some, I think I would argue, success of this, why have Americans not changed their minds about this? Even those who have benefited from the law. So if we look at the Republicans who are running for president, every single one of them, part of their platform is repeal and replace Obamacare. That is exactly what they're saying. Last week, when the vote was in the Senate to repeal the law, Senate Majority Leader Mitch McConnell from Kentucky said, "We will vote for a new beginning. We hope the House will again do the same, and then President Obama will have a choice. He can defend the status quo that's failed the middle class by vetoing the bill, or he can work toward a new beginning and better care by signing it." So it was passed out of the Senate, 52 votes saying, repeal the law. It wasn't quite a repeal, but pull back funding for it. And 47 who said no. And basically it was all the Democrats who said no, plus 2 Republicans, Susan Collins of Maine and Mark Kirk of Illinois. The House has, interestingly, passed legislation more than 50 times trying to repeal the law. It's basically been a grandstanding because always before the Senate would never join them in this. And Obama, of course, is always going to veto it. So it was really just to say we don't like the law. They knew that it would never come to anything. So the interesting part about the Senate passing it and the House this past week is, and we know Obama's going to veto it, so it sort of it's dead in the water. However, it really sets up the presidential election. Atlantic Magazine just this past week wrote, what it says is that if you elect a Republican, you can be rid of the abomination once and for all. And the Democrats, on the other hand, are saying, aren't these Republicans crazy? They're wasting our time. Don't we have more important things to do in our country than, over 50 times they have brought legislation forward on the floor. Aren't there more important things we should be doing? So it very much sets up the presidential election. Marco Rubio says, when I'm president, repealing and replacing Obamacare will be an urgent priority of my administration. Ted Cruz says, repeal Obamacare and implement market-based reforms to make health care personal, portable, and affordable. Jeb Bush is the interesting outlier among all of the Republican candidates because all the Republicans are saying, get rid of Obamacare, but nobody has an alternative except Jeb Bush. The interesting thing about his law or his proposal is that he would move the 17 million people who have insurance through Obamacare into a transition plan, but he doesn't say what that is. So he kind of has a plan, but doesn't really give us much details. And our favorite Donald Trump says, Obamacare is going to be repealed and replaced. Obamacare is a disaster. If you look at what's going on with premiums, they're up 40, 50, 55%. That was in an interview on 60 Minutes in September. So why is it that people don't like Obamacare? Why is it that 40% of the country is so not in favor of it? Why is every Republican candidate saying that, the priority of their administration, is going to be getting rid of it? So some people would say it's unaffordable, right? Even if you've got a subsidy, it's still unaffordable. despite the fact that Trump can be somewhat bombastic. He is right. There was one plan. It's the Blue Cross Blue Shield plan in Tennessee that is increasing its premiums 36%. Although the Health and Human Services, the Kaiser Family Foundation, all the other analyses say that they're going up 7.5%. So he's overly inflating what the prices are. But it is true that premiums are going up. It is also true that there's less choice over time, that part of with Obamacare is that, there are fewer choices in the health insurance exchanges. The other thing is that I think there is something about this redistributive policies in this country. If you look at our European neighbors, colleagues, however, there is more of a sense of social welfare, that there is an obligation that those of us, mostly in this room, who have a lot, have an obligation to take care of people who are less well off in their society. That's not really what we think as Americans. We are about pulling yourself up by your bootstraps and, going forward, right? And things that we do that get in the way, regulations or taxes or so on, mean that you can't do that. And so this idea about individualism, which is such an American value, compared to this idea about that we have an obligation in our society to take care of others. And in essence, that's what insurance is, right? I pay insurance. Hopefully I don't get to use it because I'm healthy, but my premiums go to help out that person who's very sick, right? That's the whole idea of insurance. It's the same idea sort of writ large of Obamacare, right? That we try to involve everyone in this, and we do that by helping people who can't afford it to get insurance. I'm going to end, before I open this up, with you may know that 2 days ago, the new governor for Kentucky, Matt Bevins, was sworn in. And he ran on a platform that included repealing Medicaid in his state. And Kentucky's interesting because 1 in 10 people got health insurance through Medicaid because of the Affordable Care Act. They did expand their Medicaid program. Some of you may have heard this on NPR. They did an interview. They went to a county in rural Kentucky where 50% of the people there get insurance through the expanded Medicaid program. And with the new governor, they're going to lose that. And so they interviewed a woman there, and she said, yes, I'm going to lose my health insurance, but I voted for Governor Bevins for all these other reasons. He's a Tea Party Republican. Like, there are other issues in the world besides healthcare. It's a shock to me, but I know. But what she said that I found really interesting was she said, we shouldn't rely on the government to give us health care. It's nice that I had it, but it's okay that it goes away. And I went away from that thinking about public education, which is also something that we give free of charge to everybody in our country, children, obviously. And I suspect that she doesn't think it's bad for the government to fund that. But in the United States, she feels that it's not good for the government to be funding health care. And yet I think that if we went to England or France or Japan or any of these countries, they would say the government should fund public education and provide us health care and whatever else sort of things. So there's this interesting dynamic, I think, here where we believe in individualism, but we also are okay with the government doing some things for us, but not everything. We're okay. All of you are in Medicare. We're good with Medicare. In fact, nobody can seem to do anything with Medicare because people love it.